little mini podcast here talking about precision and what does it mean to be precise. So lots of us think we're precise, and I'm going to talk about rhinoplasty specifically here, and say, you know what, I'm really specific, I'm super precise. But the problem with this is I don't know if that's actually translating. What people say sometimes and what they do don't always kind of make sense. So when you're talking about precision in rhinoplasty, the first thing you need to be precise is you need to see everything. And I had a previous podcast talking about seeing everything, but not just seeing everything and like seeing all the nasal bones, seeing all that, which I agree that you need to do. It's making sure you're using the proper magnification. Many rhinoplasty surgeons I've watched, as they're doing the procedure, they're looking with their bare eyes. Now, granted, some people have different vision and visual capabilities, but there's only so much a human eye can see. There's no one out there with 12x, 15x range and loops and can do that with their bare eye. That's why we have these tools. Imagine if you were a jeweler. There's no one in the world who can see a diamond without seeing a jeweler's loop. It's just not possible. That's basically the limitations of the human eye. If someone says they're above those limitations, I would love to have them just do some various tasks, like looking at and seeing the difference between, again, jewels and watches and putting this together. They won't be able to do it. So if they are doing something as precise for diamond work, of course you're going to want that to be done for your nose. No one wants to have a nose that's been done with someone who's just looking at it and just hitting it randomly with a chisel. This needs to be done with extreme and extraordinary precision. So you need to see this. The next approach is going to be, and the reason for precision, is to actually use what type of device you're using. Again, some surgeons are using giant chisels in the nose, and I'm kidding you not. 16 millimeters, 11 millimeter chisels, taking out things, cutting out your mucosa, and that's not really preserving anything in the nose. It's creating a faster procedure for sure, but that's not what it's about. And even if you think your hands are magical, as many surgeons have told other patients in consultations that they're blessed and magical hands, I would challenge that surgeon again to make some different changes on various items in other fields like diamonds, jewelries, watches, and fine tools. They're not going to be able to do that because their hands are not so magical after all. So you need some help, and that assistance for me is to use something like an ultrasonic rhinoplasty. Here I can make sub-millimetric changes and using devices that can actually smooth the nose rather than chisel away. To be precise, it's not just being blessed with beautiful hands and magical hands. It's actually having the right approaches and technique. Another thing about precision, having a plan. A lot of patients go to a doctor, and the doctor says, guess what? We're going to do what I want, and we're going to create what I want, but it's really an egotistical approach from that doctor to say they're going to do what they want, how they want. This is really a joint conversation with the patient to kind of create an image, to realize what is the patient's goals. And every patient's going to want their nose to look natural, and they want it to look aesthetically pleasing. But they also want to know, how much do I want my bump taken off? How much do I want my nose lifted? Do I want it even lifted at all? Do I want my nose narrowed or not narrowed? So this is an important conversation. So to have that type of precision, you need to have that conversation with your doctor, and I think plan appropriately. And the most appropriate and best way to plan that is going to be with 3D imaging. Three-dimensional imaging allows you spatial changes, volumetric changes, and you can actually measure and quantify your results as a doctor, which I think is super important. And if I see someone just taking standard pictures or drawing on a piece of paper what they're going to do, I wouldn't even get my back patio doing that, let alone having someone touch my nose. Another area of precision is actually measuring. There's very limited doctors who actually measure their noses in the OR. They go by feel, not using loops, using these chisels and just feeling where the nose is at. You're not going to lead to a very precise nose just by guessing how things look and eyeballing it. Again, many people think they can eyeball and put a picture up and hang it level. But there's a reason why we have other tools, such as calipers and laser levels and other things. And so for me, I want to use everything I can to make sure I'm creating the exact, as much as I can control, width and shape of the nose. So this is creating that precise approach to the nose. So in a line, Lots of us talk about precision, but to actually create precision, we need to have some sort of proof, whether it's social proof, this or that, but I need to know technique. What are you doing? What are you creating? And what's your process to get there? Thanks so much for listening to this mini podcast on precision in rhinoplasty.